Well, good morning. My name is Joe Cressy, and I have the privilege of serving as the chair of the Board of Health. Our board secretary has confirmed that we have quorum, so I'll call meeting 26 of Toronto Board of Health to order. Welcome, everybody. This is still virtual, and it is still nice to see all of your faces, despite being from afar. Today's meeting is being held by video conference. City staff are also connecting to the meeting by video conference. As City Hall remains closed, the public can participate electronically and can watch the meeting streaming live on YouTube at youtube.com/Toronto City Council Live. As we have done for a year, I will ask everyone for their patience with any delays and technical issues, and let me express my deepest thanks to the clerk's office for making this all work so efficiently for us. Although we are meeting in different locations and meeting remotely today, the Board of Health would like to acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Before we do an agenda run-through, can I start by seeing if there are any declarations of interest under the Municipal Conflict of Interest Act? If you have a declaration, I'd ask you to unmic and indicate so. I'm doing this remotely myself, so I don't have everybody on a single screen. So if you have a declaration, if you could unmic and indicate so. Okay. Next, we do need a motion to confirm the minutes from our last board meeting. Do I have a mover for that motion? Trustee Donaldson, thank you. All those in favor, by way of a show of hands. Opposed, if any, that carries. Before we do the agenda run through, can I ask Dr. Davila, is Susan Shepard on the line? Do you know do we have Susan Shepard from Toronto Public Health? Is she here?
Yes, I'm here, Councillor Cressy. I'll put my video on.
Susan, can we see, are you joining by video? We can only hear you. Before I begin there, Susan, Susan Shepard, as we all know very well, is Toronto Public Health's resident superstar. And she will be retiring soon. And so I want to begin by turning the floor over to my near and dear friend, Councillor Perks, to kick us off here today. Councillor Perks.
Thanks, Joe. Hi, Susan. I know you dread moments like this, so I won't go on too long. I was thinking back this morning about when we met, when Kyle Ray introduced us, and where things were at that point. It was illegal for public health workers to assist anybody in managing their drug use. The Toronto Police Service would destroy harm reduction kits that were handed out by public health workers. It was a time when the stigmatization of people who use drugs was at every layer and every level of our society. And that's changed. We've made real progress. There's lots and lots more to do. But we've evolved to a place where people who use drugs have access to medical care and services and supports legally. And that wouldn't have happened without your work. And it's not just that you have helped to make those changes. It's the way you did it that is so remarkable. At every step, at every stage of the work, you've calmly, patiently created an atmosphere of openness and inclusion, and you know, probably one of the most moving moments of my entire career as an elected official was when we sat down in one of the meeting rooms at City Hall with the head of the Toronto Police Service Drug Squad, Randy Franks, and a number of people who used drugs and had a frank and open conversation about the fact that they use drugs. And worked out the protocols for how we would manage a safe injection service in the city of Toronto. And at that moment, at that time, the idea that someone who uses drugs would sit down with the head of the drug squad and design a service was down to your work, was down to you creating a space where both of those people could feel safe enough to have that conversation and to design a program together. And it just was a remarkable testament to your ability to create those safe spaces for people to have the hard and necessary conversations that we had to have as we collectively learned how to save lives. And I'll always remember that among many, many moments, like sitting on a train on the way to Ottawa, with fondness, but also with a sense of guidance for how to carry out my own work. Thank you for all you've taught me. Thank you for all the spaces you've made for people to bring their knowledge and their lives openly to each other, to have the hard conversation about how we end the stigmatization of people who use drugs and actually treat them as brothers and sisters as we design healthcare services that meet their needs. Thank you for all of that. I'll always treasure and remember every moment of it.
Thank you, Councillor Perks. Dr. Davila, the floor is yours.
Thank you, Mr. Chair. And I have the unenviable task of having to follow Councillor Perks in making some comments around Susan. And I also recognize that Councillor Perks, you're quite right. This is exactly what Susan, one of her least favorite things, if I can say so. But please, Susan, every word of what Councillor Perks, I would echo 10 times over. And I would just put to you as members of the Board of Health, when I think about Susan Shepard and all that she's done, you are a true champion and you represent the best of what there is that public health and public service has to offer. You know, that amazing blend of bringing the science and the evidence forward, but always with a human and compassionate side to it, and in the objective of advancing health status and reducing inequities that exist in health status in our city. That is the very, very best of what public health and public service has to offer. And that's who you are, Susan. So on behalf of all of us, on behalf of the residents of Toronto, on behalf of the whole city, thank you. Thank you for your remarkable, remarkable service. And know that we will miss you. Right? I have benefited so greatly from your sage counsel over the past, few years. And that will be missed. But by the same token, I wish you all the very best on your well-deserved next chapter. We are expecting to hear from you about all the new adventures that you find. We will expect that you will stay in touch. And you can rest assured that there is a strong, strong legacy of, again, remarkable championship in policy, in public health practice, and in public service overall. And we will make sure that as we move forward, we'll think of you always as we make important decisions and seek to advance all the groundwork that you've laid so nicely out for us over the past several years. So with that, thank you, Mr. Chair, for the opportunity to speak. Thank you, Susan, and very, very best wishes from all of us to you.
Well, thank you, Dr. Davila. And if I might just add a few remarks. Listen, this has been a long, tough year, and we haven't spent enough time during it to properly recognize and thank so many of our Toronto Public Health staff. And it's also a time when somebody retires, we don't get to do it in person. Susan Shepard deserves all the praise and all the accolades in the world. Susan has been the manager of the Toronto Drug Strategy for more than a decade, for the Drug Strategy Secretariat that is longer still at the city. In fact, my mother, who Susan worked with, asked me to extend her thanks to Susan's work. Listen, Susan you've heard from Dr. Davila, you've heard from Councillor Perks. Her accomplishments are immense. The Toronto Drug Strategy has Susan's fingerprints all over it. That's the actual strategy itself. The Overdose Action Plan endorsed in 2017, the practical programs implemented, supervised consumption, safe supply, harm reduction programs, you name it, Susan has driven it. But it's more than those accomplishments. It's what Gord talked about. It is the way in which Susan acts. Susan has personified that which Toronto Public Health stands for by being effective and strategic, but treating people with dignity and bringing those people into the process. People who use drugs, people who work with people who use drugs, alongside politicians and academics and those at the Toronto Police Service. And I will tell you, when I began as a councillor 7 years ago and was asked by Councillor Perks to take on the mantle of chairing the Toronto Drug Strategy Secretariat, I didn't know a thing. It was Susan who mentored me. Susan, it was you. I stood on your shoulders for 7 straight years, and I have nothing but accomplishments because of you, if there were any. And so our Toronto Public Health team is a family. Susan, you are a member of that family. And I know you're an extended member of mine as well. And so as we say thank you, Susan, I do want to notice, you'll get this in person, but we do have the certified copy of the Overdose Action Plan, which Toronto City Council endorsed, which was your creation. It has been framed and it will be sent to you. We hope you will place it on a wall with pride. We love you dearly, Susan. And we do not need to put you on the spot, but we do want to turn it over to you if you would like to say a few words, but feel no pressure.
Thanks very much, Councillor. Can you hear me all right? Yeah, okay. This is very overwhelming for me, and I do very much appreciate the kind words and the generous words of each of you. It is an emotional time for sure. It's actually been 17 years I've been with the drug strategy and 25 with the city, and it's a long time. It's been important work, and I feel very fortunate to have had the opportunity during my career to work on issues that I feel passionate about, in particular drug policy. And we've made progress. I mentioned some important aspects of drug policy over there. We've got much more work to do. There is much more work to do, and I know all of you will drive that work going forward. I do want to thank Dr. Davila for her leadership and support for this work and for championing a public health approach to drug policy that's grounded in public health and in human rights principles. We need this approach now more than through the Drug Strategy Implementation Panel, our leadership table, and through the Board of Health. You have been instrumental to the work that we've done and the progress that we've made. I do want to thank and recognize my team members on the Toronto Drug Strategy Secretariat, Nicole Greenspan, Sudhisa Vanadizen, and Jennifer Levy, and so many other colleagues at Toronto Public Health, in particular Dr. Rita Shaheen and Sean Hopkins and other staff at the Works, along with the many other city divisions who work so tirelessly on these issues. I mean, this is really a collective response. But most importantly, I want to thank the many community and institutional partners, in particular people who use drugs, who have expertise and their passion and their experience to all of our conversations and decisions. None of what we've been able to do thus far to advance drug policy would have been possible without their critical guidance and support and the action which is driven so profoundly at the local level, and I do thank each and every one of them. It's really this multi-sectoral collaboration that has made the work so rich and so rewarding for me personally as well as professionally. And I will miss it deeply, and I will miss you, and I do thank you so much for making time and space at the meeting today. Thanks very much.
Well, Susan, thank you. We will celebrate in person, and following the first item on the agenda, perhaps Dr. Davila can tell us when that will be. But we look forward to that date, and we thank you with all of our hearts. So a virtual round of applause, please, and a blowing of a kiss from Councillor Perks for Susan. Thank you. Well, thank you, everybody, and thank you, Susan. We're going to now do a run through of the agenda. The first item is HL 26.1, response to COVID. There is a staff presentation as well as registered speakers on that item, so it will be held down. The second item is item HL 26.2, Toronto Urban Health Fund Program administration changes. Is there anybody who would like to hold that item down? Okay, seeing none. Would somebody like to move the staff recommendations? Moved by Councillor Ainsley. All those in favor? Opposed, if any? That carries. Thank you. The next item is item HL 26.3, Student Nutrition Program, Provincial Funding during COVID-19. This is an update from our January meeting. Is there anybody who wishes to hold this item down? Seeing none, I have an amendment I can move if it's the will of the board, if clerks can place it on the screen. This is the amendment that we acknowledge the additional funding that the province has provided towards extra costs for student nutrition programs in Toronto during COVID. And we acknowledge it, and we request for that funding to be fully committed to stabilize all learners, as well that we request the federal government, which has made an announcement of support for breakfast programs nationally. We have asked them to expedite and provide details on what Toronto's share of the funding allocation will be. So with that amendment, I can move the item. All those in favor? Okay, opposed, if any? Thank you. The next item is item HL 26.4, Ontario Public Health Standards Risk Management Reporting. Would anybody like to hold down that item? Okay, seeing none, somebody like to move the recommendation, the report with the staff recommendations. Moved by by Director Bowery. All those in favor? Opposed, if any? That carries. Item HL 26.5, City Council approved Toronto Public Health Capital Budget and Plan. This is reporting back to confirm Council approved the budget we submitted. Anybody like to move that item? Moved by Director Johnson. All those in favor? Opposed, if any? That carries. The next item, HL 26.6, City Council approved Toronto Public Health 2021 operating budget. Again, this is confirming that Council approved the budget we submitted. Would anybody like to move the report with recommendations? Moved by Director Peter Wong. All those in favor? Opposed, if any? Carried. And then there are two items of new business that I would seek support to add to the agenda. We won't deal with them now so that people have a time to review them. The first is item 26.7 under the heading Reaffirming support for our medical officer of health and a public health informed approach related to COVID. Can I seek a motion? I would like to move a motion to add that item to the agenda. Again, we will deal with it later, but I'm seeking support to add this item. Okay, all those in favor? Okay, any opposed? Seeing none, that carries. And then the second item of new business to add to the agenda is item 26.8, which is strengthening the role of the Toronto Food Policy Council. So I will place a motion to add that item to the agenda. All those in favor? Opposed, if any? That carries. Okay, this is, so our agenda is now in front of us. We have the first item is our response to COVID, and then two new business items which have been placed. Our first item has some presenters. There will be a presentation from our team at Toronto Public Health from Dr. Villa and Dr. Shabita Patty. And then there will be a second presentation from Anania Grant, the Director of Community Resources at Social Development and Finance Administration. So we'll hear the presentations. We will then go to hear from our registered speakers. We have 4 registered deputants before moving it into committee. So Dr. Davila, I will turn the floor over to you.
Thank you, Mr. Chair, and good morning all. I believe we should have the presentation coming up on a screen in front of you very shortly. And I'll try to take us through this presentation on our response to COVID-19, and this is our March 2021 update. So proceeding through the slides, and thank you to my colleagues and clerks for driving the slides there. This is a picture you're familiar with. It's how we've presented our cases to date. Unfortunately, as you can see here at the top of the slide, we have surpassed, the mark of 106,000 cases in Toronto thus far. And you can see that, there are cases within the community, those that are associated with outbreaks. Today, we will be reporting 509 new cases. We have currently 258 individuals in hospital, and unfortunately, 51 currently in ICUs. So, as we see from the numbers, COVID-19 continues to have significant impact here on our health in Toronto. There are some, indicators certainly that we need to be mindful of. And if we go to the next slide, we get an overall high-level picture of that which we see on our monitoring dashboard, and that which gives rise to concern here for us in public health and for all of us at the Board of Health and the City of Toronto writ large. As you can see on the top left-hand corner of this slide, we are seeing an increase as of late in the 7-day moving average of COVID-19 cases. And these are data, by the way, as of last Friday, March 19th. We are seeing some fluctuations in new hospitalizations for a period of time as depicted there on that small graph. We were seeing positive movement, decreases in new hospitalizations, looking at the overall 7-day moving average. Unfortunately, that has taken a little bit of an increase as of late, and we're now sitting at a 7-day moving average on new hospitalizations at 13.4. We are seeing some drops in outbreaks in institutions, notably those that are within the realm of healthcare, where vaccination efforts have been undertaken already, and we are seeing their positive effect. But on the concerning side, yet again, we see our effective reproductive number for the city sitting at 1.08. And you see as well at the bottom of this slide, an acute bed occupancy rate now at 91%. So lots of reason to, be concerned. We know we are in an environment where we have variants of concern. We are seeing evidence of resurgence, certainly. And we now are sitting at a weekly incidence rate for the week of March 14 to 20 of 100 cases per 100,000 population. So turning to the next slide, what's behind some of this? Well, certainly you've probably heard, whether it's through our press briefings, I should say, that are held here, or whether it's through other media sources, one of the driving factors here has to do with variants of concern. These are, particular forms of our virus, the SARS-CoV-2 virus, the virus that causes COVID-19. And there are mutations within the genetic structure of the virus that results in spread that is made more easily between person and person, that produce more severe illness, and that may even result in reduced efficacy of vaccine. That's what is meant by variants of concern. And we know that these variants of concern have certainly been identified here in Toronto, notably the B117 variant, the one that's most commonly referred to as the UK variant, but as well, other variants have been noted here in the city as well, the B1351, also known as the South African variant, and the P1 variant, which is sometimes also known as the Brazilian variant. At this point in time, more than 90% of the variants that have been identified here in our city have been of the B117 variety. Turning to the next slide, just to give you a little more context around the status of variants of concern here in Toronto. We are seeing them in settings across the city, and they are increasing as a proportion of those cases that are confirmed. As you can see here on the slide, a variety of settings have been implicated in terms of identification of variants of concern. And we are seeing that particularly in settings where people gather, congregate settings, the number of cases of these variants of concern, notably that B117 variant, can build very quickly. These variants of concern and this particular variant of concern is associated with increased transmissibility from person to person. Hence, you can see pretty rapid spread within a group or congregate environment. And what is really required is vigilance and diligence in practicing infection prevention and control measures. And we do note that altogether, we are truly only as strong as the strongest measures for those who are most vulnerable. We recognize that this is an important component of the response. And knowing what we know about the transmissibility of these variants, this point cannot be overstated. Turning to the next slide, we now know that over half even now, of Toronto's cases are variants of concern. This depicts the proportion of cases that are variants of concern and screened positive by the reported week, and these data reflect what we know from the end of December to early March. And you can see that there is a significant increase in the proportion of all cases that are represented by these variants of concern. I think it's important to note as well that in our experience on the ground, when we talk to members of the Toronto Public Health team that are supporting the investigation of variants of concern in various settings, there are a couple of key points to note. One, that even as variants of concern get introduced into settings where people gather, workplaces of all kinds, schools, etc., we know that with heightened transmissibility, these variants of concern can quickly spread. Again, that's the characteristic. It's what defines increased transmissibility. It's part and parcel of that. However, what we have also noted, based on our experience on the ground day to day, is that good, consistent, sustained infection prevention and control practice can go a long way towards reducing spread, even in those environments where you have multiple people gathering together in congregate groups. So there is some hope there, but it does require a great deal of adherence and a great deal of vigilance around practicing consistently infection prevention and control measures. Turning to the next slide, how this is manifested here in our environment is that what we're seeing currently is that our effective reproductive number is above 1. The members of the Board of Health will recall that this reproductive number refers to the number of new cases that arise as a result of each new case of COVID-19 that's diagnosed. And a reproductive number of 1 or higher means that our outbreak is growing. So unfortunately, at this point in time, you'll see to the bottom left-hand side of the slide that our current effective reproductive number is, roughly rounded 1.1. So clearly above 1, and therefore indicative of the fact that our outbreak is growing. Turning to the next slide, though, what's particularly concerning is that the effective reproductive number, the same number specifically for the variants of concern, is actually 1.2. Again, I would draw your attention to the number at the bottom left-hand side of the slide. So given that we're talking about, exponential growth, there is a significant difference between 1.1 as a reproductive number overall versus 1.2, specifically looking at the variants of concern. And it tells us that a goodly part of the growth that is happening here in the city is with the variants of concern behind them as the driving force. Turning to the next slide, so we are seeing resurgence, and we have seen resurgence before. Those of you around this table are familiar with what we have seen over the course of the past year and a bit. However, this resurgence, is different from what we have experienced in the past. And that's because our environment, our circumstances are different. For starters, we do have vaccine, in our toolkit now, if I can refer to it as such. Looking at our data up to and including March 17th, we know that there are just under 250,000 people that have received at least one dose of vaccine here in the city. And I note that these are data from, the middle of last week. So that number has only grown. And in fact, our most current data as of today says that 374,631 doses of vaccine have been administered thus far here in Toronto. So as of last week, we estimate about 7% of the population has received a first dose, and that number continues to grow as vaccination efforts continue to be implemented and deployed all around the city. As well, as I've mentioned to you, and as we've just been discussing over the previous slides, we know that we have variants of concern, and they are now representing more than half of all cases that are being identified at this point in time in the city. The B117 has been the focus of our efforts. It has been the one driving the growth in cases, but of course, as mentioned earlier in this presentation, there are other variants of concern that have been identified here in Toronto, and they do need to continue to be monitored. What has been noted, whether we're talking about B117 or other variants, increased transmissibility is certainly one factor that we're worrying about. And as well, what has been noted with B117, looking at the experiences of other jurisdictions, is more severe outcomes associated with these infections. So another factor for us to be mindful of and to monitor very carefully and to adjust and adapt our response in accordance with this. And then finally, we are, now officially in spring. Weather, if this weekend was any indication, should be getting better. And it does allow for some opportunity for all of us to be able to engage in activities in a lower risk setting. We know that outdoor activities undertaken outdoors are certainly lower risk in terms of COVID transmission relative to indoor activities. That's not to say that they are no risk, but the risk certainly is decreased when we're talking about activities that take place in an outdoor setting, larger volume of air, with clear ability to disperse, and therefore just lower risk relative to the same activities being conducted within an indoor environment with less ventilation. Turning to the next slide, we're looking at hospitalization numbers, which continues to be, a source of concern. Members of the Board of Health will recall that one of the key objectives of the COVID-19 response overall has been to preserve and sustain the capacity of our healthcare system to provide care to those who require it, whether it's for COVID-19 related issues or all the other medical issues that can arise in the course of our daily lives. Unfortunately, what we're seeing here is that there is, a real possibility for hospitalizations to start to increase as a result of the activity we're seeing now. And in fact, as you can see here depicted on this particular slide, projected hospitalizations can vary quite a bit depending on how much of an increase in transmission we see as a result of the current circulating variants of concern relative to what we have seen in the past. So you can see that the numbers go quite high and in an alarming way, particularly as transmission, as transmission increases and as different scenarios are looked at using the best available models right now. So this is certainly something that we are monitoring for very carefully, and as well our healthcare partners are also keeping a very watchful eye on this, making sure that they're doing the best they can to preserve their resources in the event that this sort of eventuality comes to pass. Turning to the next slide, again, this is a variation on a theme looking at what we might anticipate as a result of increased transmissibility of variants of concern. And as you depicted on this slide, whether we're talking about the cumulative case counts or cumulative deaths that result from COVID infections, the short and simple explanation here is that, if we see scenarios where variants of concern really demonstrate that higher propensity for transmission from one person to the next. This has a significant impact in respect of the number of total cases that we see by the, over the course of time, and the number of deaths that we see over the course of time, unfortunately. So that's just a different perspective on what the models are actually showing us. So I will take us now to the next slide, and the last for me in this section. The key points that I just wanted to draw out as a result of all the slides we've just been through is that we are indeed in a resurgence in COVID-19 activity. And while we have seen resurgence before, just given our circumstances now, where we are in the pandemic, with the availability of vaccine, and with variants of concern being a new feature, and as well with warmer weather providing for opportunities for some safer activities to happen. While we've been through resurgence before, this time it will look different. I do think that there is a lot to be said around vaccination. Vaccination we've seen thus far has been very, very effective in terms of reducing the level of disease and transmission, particularly within the context of long-term care and retirement homes. So I think that shows how much promise there is for vaccine. Unfortunately, we simply don't have enough supply at this point in time, and therefore there isn't enough coverage. So hence the point made here on the slide that vaccination alone will not be enough to stop the current resurgence and its growth as we're seeing it now. The good news is that, as I said, vaccination is effective. It does, however, take some time before it is able to demonstrate its full impact. So we certainly have the cause for optimism in the weeks to come, but we do need to continue to expect that we will see more cases, and that those cases will potentially lead to significant stress on our healthcare system and its capacity to respond. With that in mind, we would continue to emphasize the need for a strong public health response, yes, from us as the local public health department, but also, strong adherence and continued vigilance by all members of the public to measures for self-protection. We know that distance does make a difference, even in the face of variants of concern. Distance and the appropriate use of well-fitting masks continues to be important components of what each and every one of us can do to help allow for vaccination efforts as they roll out to be as effective as they can be. These continue to be the components that I think we all need to focus on. So with that, I will now turn it over to Dr. Padhi to speak a little bit more about vaccination efforts.
All right, thank you, Dr. Davila, and good morning, everyone. So just to inform everyone of recent announcements, as of this morning, we now have individuals who are aged 75 and over who can begin booking with the provincial booking system. And as of 8 a.m. this morning, we've had extremely good uptake. Within the first 50 minutes, we had 5,000 appointments booked. So a lot of interest, which is exciting. And also 60 years and above can also begin booking and participating in the AstraZeneca pilot that's being hosted at 5 pharmacies and primary care providers. We are also in the process of expanding pharmacy locations across the province, so 350 new locations to be added within the next 2 weeks, and we're aiming for a total of 1,500 locations by the end of April. We are currently also accelerating our plans for phase 2. So that is the addition of the additional age categories in 5-year age band spans. And actually, you'll note that those individuals 75 and over were actually slated for the phase 2, and we've actually moved them up earlier, which is great news. We're also looking into immunizing in congregate settings, which includes correctional facilities, supportive housing, developmental services, and similar type locations. Those also with high-risk medical conditions, such as individuals who may have had bone marrow transplants or organ transplants, individuals suffering from obesity, those who may have disabilities and suffer from diabetes, they will also become a priority in phase 2 for immunizations. There is also, the province has announced a hotspot strategy that includes mobile teams to focus on seniors in highly impacted neighborhoods, and particularly in our so-called vertical communities of apartment complex. And we're working with our Ontario Health and LIN partners on that strategy at the moment. Next slide, please. Prior to speaking to our rollout in more detail, I do want to emphasize that the vaccines are safe and effective. All of the COVID vaccines have undergone the review and rigor required prior to being administered to individuals in the public. And of course, this has been done by Health Canada. And we live in incredible times where just under the span of a year, we have 4 extremely effective vaccines that work well at preventing hospitalizations and deaths. And this is just a testament to how far science has come along. That said, unfortunately, polling done in the fall showed that 11% of Torontonians are still unsure about whether they will take the vaccine. And we know vaccine hesitancy is fueled by things like convenience, confidence in the vaccine, as well as complacency. And it also doesn't help that we have a lot of misinformation about vaccines circulating on social media and the internet, which is further fueling this hesitancy. For many racialized groups, vaccine hesitancy can also be based on a long history of mistrust with the government and healthcare institutions. The city has recognized this and has created a vaccine confidence working group. And currently, this working group is being led by Dr. Vanita Dubé, one of our associate medical officers of health, and is collaborating with community partners to empower them to talk about vaccines to their clients and to their communities so that individuals can make an informed choice. Next slide, please. I also just want to go over again the roles and responsibilities of the differing levels of government. The Government of Canada is responsible for procuring vaccine and bringing it to the country. And as mentioned earlier, the vaccines are approved by Health Canada after they've done their rigorous scientific and clinical evidence reviews. The Government of Ontario is responsible for distributing the vaccines to the various health unit jurisdictions. And it also identifies the priority groups for vaccination. Our role at the City of Toronto is to administer the vaccine in accordance with the provincial prioritization framework. Next slide, please. The Government of Ontario has actually created a 3-phase plan in regards to vaccine rollout. And phase 1 has prioritized those individuals who are highest risk for severe outcomes as well as death and frontline healthcare workers. We are presently in phase 1 still. We're nearing towards the end, and as I mentioned, we are starting to immunize some phase 2 population, so the 75 plus. This, of course, is contingent on vaccine supply as well as the number of people who get immunized. So as we get more vaccine supply and as we have more people immunized, we will move through the various phases. And, of course, as alluded to earlier, we are in the planning phase for phase 2. This is going to be quite a complex phase as there are many priority groups, and we need to ensure that they get immunized. Next slide, please. Just to highlight the complexity of phase 1 in Toronto specifically, just want to give you some approximate numbers. Of course, we're a city of approximately 3 million people. In phase 1 alone, we had almost 400,000 people who were deemed eligible for the vaccine. And if you look at the different subgroups of individuals who were eligible, you can see the numbers are quite large, and some are the size of cities and townships in Ontario. So this is quite a massive undertaking, which is why it's taking a fair bit of time. But we've, our partners and Toronto Public Health has come to the challenge, and we are getting these individuals immunized. Next slide, please. So our City of Toronto mass immunization clinic plan. So what this entails are 9 fixed mass immunization clinic sites plus 5 mobile sites. And these 9 fixed sites can have a throughput of 2,000 to 4,000 individuals per clinic per day when we are operating at max capacity. And we've actually successfully launched 3 of our clinics as of last Wednesday on March 17th. We launched Metro Toronto Convention Centre, Scarborough Town Centre, and Toronto Congress Centre. They aren't operating at max capacity because that, of course, is contingent on vaccine supply. So we are doing a slow ramp up, but we've had a phenomenal uptake and a lot of satisfied customers, a lot of happy people. So it's been a real pleasure to see. Coming on board the week of March 29th, we have 2 more clinics, one at Malvern Community Rec Centre and one at Mitchell Field. And then a 6th clinic at the hangar in the Downsview Park area will come on board on April 8th. The 3 other remaining clinics will eventually come on board and is, of course, contingent on vaccine supply. Next slide, please. So on our website, you'll be able to see all the locations of our various mass immunization clinic sites. As they come on board, you'll get information on parking and accessibility. And also, there are maps there available of all our various partner sites as well. And I'll speak to that on the next slide, please. So we have options for residents of Toronto. Not only do we have our city-run mass immunization clinics, we also have mass immunization clinics run through our various hospitals, Ontario health teams. Of course, the pharmacies and primary care providers also play a huge role. And for individuals who cannot, make any other clinic, can't leave their home, we will have mobile teams available. And also, I just wanted to add, there is a table at the City of Toronto that is working on providing transportation, low-cost, no-cost opportunities for individuals to help facilitate their access to clinics. Next slide, please. So this is a new tool, just kind of shifting gears here, that we are launching on our website, which is a dashboard depicting how our vaccination rollout is going in the City of Toronto. And from our latest numbers, over 300,000 doses, this includes both first and second doses, have been administered in the City of Toronto. And at least 247,922 individuals have received 1 dose. And we're looking at least around 6.9% of individuals overall in the population who have received 1 dose of vaccine. So still a bit far off from, herd immunity, but we are slowly moving in that right direction. And this dashboard will be updated by our team every Monday and Thursday and is available to the public. Next slide, please. And I just wanted to highlight, too, the dashboard not only demonstrates how many doses have been administered in the City of Toronto, but also by how many residents. And so you can apply that filter to that dashboard. So in terms of first and second doses, 274,384 doses have been administered to specifically to residents of Toronto. And like I mentioned before, that represents 6.9% of the population. So I think that is the end of my section, and I'll hand it over back to Dr. Davila. Thank you, everyone.
Great. Thank you, Dr. Patty, for that excellent presentation. I know we have one more component of a presentation to follow up, but Mr. Chair, if I might, I just wanted to call the attention of the board to the fact that tomorrow we do mark that 1-year anniversary of declaration of emergency here in the city of Toronto by the mayor. And so it is important to mark those milestones, I think. And if I could just take a few moments of the board's time, I would first and foremost just like to, one, recognize that we are at this point, a full year into an emergency declared in the city, the longest continuous running emergency in the history of the city, at least to my knowledge. I want to just take this opportunity, if I might, to thank the board, certainly to thank the mayor, to thank you, Mr. Chair, Councillor Cressy, for all the support specifically that has been provided over the many months of this emergency. And certainly, I would like to thank our city colleagues who frankly are just too many to name at this point in time. I would, however, like to take this opportunity to issue special thanks to the team at Toronto Public Health, who continue to truly respond, at a remarkable level, day after day, past the point of exhaustion, and in the face of increasing demands and scrutiny, and with increasing pressure, I would note, as time presses on, pressure that's actually faced from all fronts. So, thank you to the team at Toronto Public Health. It feels like it will never be enough, but I feel like I have to continue to say thank you to the team at Toronto Public Health for everything they've done, for everything they're doing, and for everything that they will continue to do, as we still have quite some response in front of us in the weeks and months ahead, whether we're talking about responding to variants of concern and resurgence, or whether we're talking about implementing the largest immunization campaign, again, in the history of the city. If I can briefly, at this point in time, people often ask in interviews, who is my hero? And, my first answer, quite personally, will always be my mother. But a very close second now, I will have to say, is the entire team at Toronto Public Health, right? My colleagues at Toronto Public Health have demonstrated heroism day after day after day. And they continue to do so because they're passionate about public health. As we were talking about earlier this morning, they represent the best that there is in public service. For that, they are my heroes too, and I simply cannot thank them enough. So with that, Mr. Chair, perhaps I'll turn it over to another hero of mine, Anania Grant, one of our colleagues from the city who has been so instrumental in helping us as part of this response, for her component of the presentation.
Thank you, Dr. Davila, and thank you, Board, for having me back to give you an update on the work that we've been doing. Truly, our role in the community engagement and mobilization plan is to make sure that we are supporting TPH on their efforts, which is a lot and has been amazing as they align with the Provincial rollout. So really, we are kind of that back end, making sure that every corner of Toronto gets access to vaccine. So thank you again. Next slide, please, Vanessa. And so, as I said, I shared when I was here the last time, our plan is really grounded in community. It's about collaboration. We're doing every step of this plan. We're working hand in hand with the people who really know community, which is our community agencies and grassroots groups, especially as we move into this phase 2 and phase 3 of the Provincial rollout. The plan is robust, and we have been really leaning on active partnerships with our trusted agencies, sector umbrella organization, and grassroots groups. And we want to make sure that this plan really speaks to supporting the disproportionate impact, or shifting the disproportionate impact that COVID has had on so many. This plan, this work that we're doing, I want to say thank you to all the folks that are working with us. This is not just SDFA, it's not just me. It's a mighty team of collaboration with SDFA, TPH, Toronto Public Health, our SSHA colleagues, and of course, Strategic Communication, who has been amazing at advising and guiding us as we do this. Next slide, please. And so, again, this is about ensuring that we use a targeted approach to this work. Always about targeted universalism, making sure that those who are most affected, those who are most marginalized, are at the forefront and prioritizing everything we do. So in Indigenous community, of course, always being prioritized, Black communities and other populations that have been disenfranchised through COVID. People with disability, we know, has been affected largely and is, for most part, seemingly invisible because we don't have the stats, but we know that they're being affected largely. South Asian community, land community, seniors, of course, those who are homeless and those who are undocumented, and the LGBTQ community. Next slide, please. And so we gave you a timeline when I was here last time, and we're working through that timeline. And so throughout the, January, we were just putting the plan together, got approval for the plan. And throughout the month of February and March, we're still focusing on, the grounding in the engagement framework and seeking input and building vaccine confidence. And I'll share with you how we've been doing that, and making sure that we're pivoting engagement and mobilization support as needed, because this is an ongoing changing. I keep saying to the team and everyone we work with, every day is a new day in this environment, and so we must be able to be agile and flexible and pivot as needed. And so as we move into April, our focus is on finalizing engagement with a partner organization, providing and developing and providing training. And our training will include support and expertise from behavioral scientists, but as well as community experts and communication professionals as we amplify the collaborative process. And we say, this is the work we're doing is April onward, because we will be with this plan as long as we need to, hopefully sooner than later, that it won't be too long. But, engaging and mobilizing and amplifying is what we're focusing on. We will be working with 140 community organizations, 280 resident ambassadors to get the word out, to build confidence, to make sure that every single corner of Toronto is reached and every resident is reached. And we will do continuous training for all the resident ambassadors, agency, but also city staff, and continue evaluating how we're doing it. It's going to be truly incremental evaluation so that we can improve as we go forward. Next slide, please. And so I want to share with you a couple of updates so far. On March 8th, we released the call for proposal of $5.5 million to community agencies. As I mentioned, we need community agencies to do this work. They're the ones who are the experts. They know, they're trusted. And so efforts will be made across 140 Toronto neighborhoods. And as I mentioned before, we'll be recruiting 280 community ambassadors. So we're working on an additional $1 million for Indigenous agencies and groups to self-determine their approach to community engagement and mobilization. This grant program prioritizes targeted equity engagement and mobilization actions, specific geographic areas and connection to existing community cluster infrastructure. You may remember that we developed a community cluster infrastructure earlier on in COVID so that we could support residents through community agencies, and that we could hear from residents what the issues were so we could respond quickly and effectively. And we're using that same model as we move into this work as well. And to ensure that we have a common message that aligns with the provincial and federal messaging, the timing, and the direction. We're using, of course, evidence-based research to guide our strategy, our messaging, and our training to increase access to vaccine. And our plan, this program, will be agile. Right now, we have a structure. We know where we're going, but it really depends on what the changes are. And we must be agile in what we're doing and be able to pivot very quickly to respond to residents. Next slide, please. Just a little bit more about the funding. The submission will close on March 29th, and we will announce who the agencies are that will be supporting residents by April 6th. And then we intend to be rolling this out and working on the collaborative process by the middle of April. I want to share just a little bit more. What this is about is consortium. So all the neighborhoods, so we have 140 neighborhoods. What we're doing is we're going to have a main organization, a key organization that we're calling the Vaccine Engagement Lead. This community agency organization will be will lead because they have the capacity to do so, and then they will be working with smaller organizations and grassroots groups together as a consortium so they can support residents everywhere. And we will be providing up to $500,000 per vaccine engagement lead so they can do this work right across the city. Next slide, please. Want to give you a little bit more update. Seniors is at the top of our list right now, the top of mind for everyone. And so when we talk about how this plan is being rolled out, it is population based, it is place based, and it is knowledge based. And so from a population's perspective, seniors, of course, is a high priority for us now. So we are working with several seniors agencies. The last count was over 40 senior agencies that will be helping us to reach seniors, to build vaccine confidence. We've been doing information sessions with sector leaders and staff and healthcare workers and frontline workers so that they can build their confidence as they support seniors. We are providing and working on, we will be finalizing all of this, free and assisted transportation to and from vaccine sites for seniors across the city. We're providing funding support to senior serving organizations to ramp up staff capacity so they can outreach and support staff with vaccine appointments and transportation. We understand that not all seniors have the support. Not all seniors have a child or a neighbor or a supporter that will do the call for them. Many seniors are not savvy. So we want, so agencies will be calling to check in and say, how do you need support? Do you know that the vaccine is here? This is the place that the vaccine is at. Let us help you to get registered. And by the way, do you have transportation? We will get you transportation to and from. It is so critical that we reach as many seniors as we can, as quickly as we can, so that they can get the support that they need. We at Toronto Public Library is also helping us with that to get information out. They have a list of seniors that they work with. 20,000 was the last count, and they will be doing the same type of work. We are also doing promotional. I thought I'd share the pamphlet we're using that Strategic Communications has put together, and we're dropping those in things like seniors food hampers, making sure faith communities have them, multiple languages. We're doing everything that we can to make sure that seniors get vaccinated and we can save lives. Next slide, please. And so as we talk about populations, just want to touch on, as we mentioned, Indigenous populations who will make decisions around how they outreach to their populations. But at the moment, we are working with 3 Indigenous organizations and are making sure that they have the funds to do the outreach that they need and also to support with testing and contact tracing. South Asian population, as you know, is the numbers are going up, so we have to pay attention there. So we've been doing a lot of work, lots of meetings, really hearing from them how they want to be supported, what works for them, what languages work for them, working with faith communities and their umbrella organizations such as CASA, and providing them with funding support as they need it. We're looking at, they've been already doing town halls and seen a 20% reduction in those who are saying, I don't trust the vaccine. Now they're saying, I will take the vaccine. So that's awesome. Similar work is happening in the Black community through our partnership with the Taibu Community Health Center. I talked a little bit last time about the Black Scientist Task Force, who've been doing tremendous work. And while it's a Black Scientist Task Force, the work is focused on Black community, I want to say that it's reaching everyone. This is the thing about targeted universalism. When you focus on one group that is much marginalized, it supports everyone. And this is what we're seeing here. The last, our last stats showed that we've had a 16% change in vaccine hesitancy. So 16% more folks are saying, yes, I will take the vaccine. After coming into town hall saying, I will never take the vaccine, now they're saying they'll take the vaccine. So we're seeing so much support. Next slide, please. And we still have a lot of work to do. We're focusing on the disability community, lots of work. We're building a task force with the same model we use with the Black Scientist Task Force. We're having town halls. We're getting ready for town halls with the disabilities community. Of course, it's complexities, of course. So we don't know the answer, but we hired a consultant who's going to help us to really understand how to access this community and how to truly support this community. Same thing with the homeless community. We're doing those who are homeless, doing a lot of work through SSHA and their peer workers, their poor workers program. And of course, we can't forget those who are undocumented, and working really closely with communications and TPH to make sure that everyone gets vaccine who wants to get the vaccine. And so there is, I'm sure you know, there's been a lot of conversations around undocumented residents. We are working with agencies who know undocumented residents so we can support them. Next slide, please. Again, I'm really giving you very high level, but at the end of it all, what I want you to know is that we are doing this through a collaborative effort, not only collaborating with our colleagues from different divisions, but also with the community. It is the community that is going to help us to drive this. Studies have shown that's the only way to go. That's the best way to go. So, you know, I have to always end with this African proverb that speaks to, if you want to go quickly, go alone. But if you really want to go far, go together. And that's the approach that we are taking. Thank you so much for having me back, and I will continue to update you as best as I can. Thank you. Next slide, please.
So thank you to Dr. DeVita and her team, and to Anania Grant. I think that last slide speaks to what we've just been presented with here. If you want to be successful, you got to go together, and you're seeing a whole of city response here. Anania does not work for Toronto Public Health. She works for Social Development and Finance Administration, but it is a City of Toronto response with TPH playing the central role in many ways. So thank you all. We're now going to turn to, we have 4 registered speakers. We're going to hear from our 4 deputants before we bring it into committee. To our 4 speakers, you'll each have 5 minutes. I'll give you a 30-second heads up as you're approaching that 5-minute window, and members of the board will have a chance to ask you questions. And so I will ask our clerk's department if they could prepare our first speaker, Erica Barber. Erica, do we have you on the line? Just ask clerks. Clerks, do we have Erica? If somebody from clerks could just clarify if Erica is on the line or if we're having challenges connecting, please.
Mr. Chair, this is Julie. I'm just confirming with my colleague Nahom, the WebEx host, just to find out if Erica is connected right now. Nahom, do you have an update on this?
Yes, Erica is connected. I am unmuting her mic now.
Great.
Erica,
hello, can you hear me?
Erica, we can hear you. Thank you for joining. You'll have 5 minutes, and I'll give you a heads up as you're approaching the 5-minute mark. So we'll turn the floor over to you when you're ready.
Okay. Well, thanks for the opportunity to speak today. I'll keep it brief. It's not the kind of thing I would normally do, but if it weren't for the fact that I barely recognize the society that I live in and that I used to understand, I wouldn't be doing this. Instead, I feel like I'm living in some kind of communist, dystopian, collective nightmare that I can't wake up from. I want to go on the record today in front of all of you and tell you how upset I am that this great crime you are participating in against the citizens you're paid and entrusted to represent.
I'm just
being
going to have
done.
to pause you there for a second, Erica, that under the procedural bylaw, we would ask that you not use offensive language or speak disrespectfully towards anyone, and that includes comments related to crimes committed. So I would just note that as your first warning. Back over to you. Thank you.
Okay. What's being done with the masking of our children in the schools is diabolical. It's theater and fear porn meant to terrorize them. They can't consent. It's being done to them. It's the ultimate inversion because we should be protecting them. They're not viruses. The lockdowns have crippled small businesses and bankrupted thousands. Lives have been utterly destroyed. Labor laws and safety standards are being completely ignored with the forced masking of employees. If it were about health and safety, there would be some level of standards for the masks, some form of testing for the fitness levels of those being forced to wear them, but there's not. It's a blanket enforcement across all ages, all professions, all fitness levels. Only a devil would want to take away our very right to breathe.
So
if we have a God-given right.
I'm going to note under the procedural bylaw around the use of offensive language, referring to anybody with respect to Toronto Public Health as a devil, I infer as offensive language. This is your second warning. Upon the third, I will ask the recording secretary to turn off the mic. It's back to you, Erica. Thank you.
If we have a God-given right, it's the right to breathe. As you force us to put on our masks, you unmask yourselves and reveal your unholy allegiances. It's wrong. You're acting as traitors to Canada. Whatever Faustian pact you've entered into will not be worth it. The devil's a liar and there is no truth in him.
Okay, I will. At this point, Erica, I thank you very much for your deputation. You have been warned on 2 accounts related to the procedural bylaw and disrespectful language and offensive language. And so to the recording secretary, I would ask that you end this call.
Honor your oath.
Okay, thank you very much. And thank you, Erica, for joining us today. Our next speaker is Graham Lamb from the Coalition for COVID Safe Club Reopening. Graham, welcome. Thank you for being here.
Hi, thank you so much. Can you hear me okay?
Graham, we can hear you loud and clear. You'll have 5 minutes, and I'll give you about a 30-second heads up before we're approaching that, but thank you for being here.
Yeah, fantastic. Thanks so much. So I know that the members of the board have already received the text of the petition that we submitted just over a week ago. So I won't go over the full contents of it, but I'll just give a bit of background. So I was an employee of a Toronto bathhouse for around 3 years until they were all closed in March last year in response to the COVID-19 pandemic. I was more recently the person selected by my coworkers as the employee rep on our joint health and safety committee, and it's in that spirit that I've been having conversations with my coworkers about what it would look like for us to go back to work and feel safe. We want to go back to work, but we need to have that addressed, and so we've anxiously kept an eye on similar clubs that have reopened elsewhere in Canada. I say anxiously because, generally speaking, they've been reopened under COVID-19 guidelines that were developed for substantially different businesses, and in-person outreach services such as counseling, HIV testing, and safer sex supply distribution that have been an integral part of how bathhouses have operated in the city since the height of the AIDS crisis have remained suspended as clubs reopened. Last March, I remember for about a week when outreach services stopped before the bathhouses had closed, then several regular customers would come up and ask me, if it's too risky for the outreach staff, is it safe for them? And that question tells me that when these clubs reopen, the availability of outreach services is going to be a key component of making everyone feel safe going back. So to sort of imagine what that could look like, we've collaborated with AIDS service orgs to develop some proposed measures for bathhouses reopening before full herd immunity is achieved. Our goal is not to have our bathhouses reopen prematurely, but to make sure that when it's appropriate for them to reopen, they can do so immediately with measures in place that have already secured community buy-in and confidence. We don't want a situation like what we saw in Montreal last summer, where after bathhouses reopened, community health advocates were quoted in the press calling for bathhouses to close. Those sorts of headlines are bad for the businesses, they're bad for the whole community. We don't want a situation like what happened elsewhere in Ontario last November, where bathhouses reopened as the second wave of the pandemic was rapidly picking up steam, only to close again shortly thereafter. That again is bad for businesses, it's bad for community trust. When the time is right, we want them to reopen for the long term with COVID-19 measures in place that secure community support and allow in-person outreach services to resume. We're engaging constructively with bathhouse operators to flesh this out, but none of us are public health experts. And that's why, as our petition states, we believe the best way to ensure community buy-in is for Toronto Public Health to conduct appropriate consultation and provide bathhouses with appropriate guidelines. Bathhouses are uniquely important to our community. A lot of us who work there are also customers there. We understand how important this is for queer people's lives, but they're not gyms, they're not restaurants, they're not hotels. The forms of risk are different in a space where patrons are primarily meeting for sex. We believe they can be reopened safely, but they need to be supported with credible guidelines reflecting this reality. Thank you.
Thank you very much, Graham. I'm just going to open up the floor. Are there any questions for Graham? Councillor Wong-Tam. So Graham, this is the chance where Councillor Wong-Tam will have an opportunity to ask you questions. So Councillor Wong-Tam.
Great, thank you so much. And Graham, thank you for your deputation. I believe you are part of the organization that's a coalition that's asking for the safe reopening of bathhouses. We had just had a meeting with this coalition as of last week. Were you briefed on the outcome of that meeting?
Yes, absolutely. And we are having a meeting with the bathhouse operators in about 10 minutes to follow up on the outcomes of that.
Okay, that's fantastic. I just wanted to make sure that, just because I recognize that there are several different stakeholders having important conversations around the same matter, which is the intention to safely open. I just wanted to make sure everyone was on board. So then my follow-up question to that is, after the coalition meets with the bathhouse owners and operators, there was a strategy to ensure that we can all come back together, including Toronto Public Health staff, who are going to be committed to working with you to establish those guidelines, or at least to do the best that they can to provide you that guidance. Are you in agreement with that approach?
Yes, hopefully. Again, I think, we all recognize that any sort of measures need to have the support of the operators. They need to be able to keep their businesses sustainable, right? And so we're optimistic that there's a lot of common ground here, and we're looking forward to moving forward together with that. Absolutely.
Okay, thank you.
But we do ultimately, I guess, if this addresses your underlying question, ultimately, whether it's consultation that starts out at Toronto Public Health, or what we're sort of taking on, where we're trying to do that process ourselves and then bring it back to you, we believe that ultimately what's going to make everyone feel safe is for Toronto Public Health to sort of eventually assess the effectiveness of whatever proposals emerge from that process.
Yes, I would tend to agree. I think just for point of clarification, I think the coalition members, the communication at the last meeting was that they were aware that the provincial, that the province was setting out the protocols, and it was the province that was specifically responsible for establishing what safe protocol reopenings could be. So the public health team would of course work with the province to make sure that your concerns were brought to their attention, and we can then come back to you to establish those positions moving forward. I think just my question would be to you. I hope that you can appreciate the complexities, and that you and the coalition will continue to work with Councillor Cressy and myself and the Toronto Public Health staff as we move forward to address this with you. Would you agree with that being a reasonable approach?
Yes, absolutely. I think that our intention in bringing this petition to the Board of Health is simply that, while the province will play an overdetermining role in when these clubs reopen, the city still has a role in helping to bring together stakeholders and work together in making sure that whatever comes down does reflect the needs of community stakeholders. And we're confident that we've taken some initial steps in that direction, working together with yourself and Councillor Cressy.
Okay, thank you so much, Graham, for your time and your attention and your deputation today.
Thank you.
Thank you, Councillor Wong Tam. Are there any other further questions for Graham from members of the board? Okay, seeing none, Graham, thank you very much. I'll then go back to our team and the clerks. Our next speaker is Mark Maloney. Do we have Mark on the line?
Yes, hello. Can you hear me?
We can, Mark. Welcome. Mark, you'll have 5 minutes, and you can begin when you're ready.
Thank you very much. And I first wanted to say thank you to the board and to Dr. Davila and her team for all the work you have done in the last year. It's been outstanding. I'm just here as a private citizen to offer a suggestion that I'm hoping you may act on. I'm not here on behalf of any institution or group or business or whatever, but I'm hoping to just be a voice on behalf of thousands of people who cannot be here today. By that, I mean thousands of residents of long-term care homes in Ontario who are trapped, and I mean trapped in their rooms and have been for a full year since March of 2020. Dr. Davila's monthly policy reports are very wise, they're thoughtful, they're well considered, and they do produce results at Queen's Park and in Ottawa. I'm asking that you add a recommendation number 4 to the 3 that are in today's report. And it would be along the lines that the Medical Officer of Health report back to the April 12th board meeting on the very latest status of the province's plans to bring in a protocol to allow residents of long-term care homes who have been fully vaccinated to be able to go out for the first time in over a year. And also, with the proper procedures and oversight in place, be able to go out somewhere outside the home with a family member or a friend or a volunteer or a caregiver who they designate and who has also been fully vaccinated and if need be tested or retested again before going out. The matter, excuse me, of long-term care residents being trapped is a major policy issue, and I have not really seen it raised or discussed much publicly at all. It's a serious, serious issue affecting thousands of Torontonians who've been left in their rooms for a year. And keep in mind, just as of this past weekend, we now have thousands of people in Toronto able to dine outdoors. Yet we have thousands of vaccinated long-term care residents who must still remain inside for even more months to come. I believe this is a serious and a really total disconnect, and it cannot continue. In March 9th, the New York Times did a big story on Ontario's long-term care homes. You can see it online on the New York Times website. Dr. Samir Sinha, the director of geriatrics at Toronto Sinai Health and University Health Network, went so far as to say that homes are, in his words, actually violating people's human rights. That's his words, not mine. Please allow me to give you just a small personal background to all of this. Since 2008, I have looked after, supported, cared for, financially helped a friend who is in a long-term care home in downtown Toronto. Her name's Virginia. She will turn 75 this July. She's given me full permission to speak about her. She has been confined to her room since March 12th last year and unable at all to leave the building for much of the past year. She was actually literally confined to her modest 2-person bedroom, not even allowed into the hallway. And she and thousands like her are not permitted visitors, guests, family, or friends. And they have not been for over a year now. And we're talking 115,000 people who are in that situation, like higher than the entire population of Thunder Bay, Brantford, or Pickering, or Newmarket. Her only lifeline to the entire world outside is her television and her phone. And most of her fellow residents, 126 of them in the home, do not even have a television. So they're staring at the ceiling in their beds 365 days a year, 24 hours a day. Virginia has some development disabilities. She suffers from anxiety, depression, loneliness. And prior to the pandemic, I used to see her regularly, like twice a day in most cases, popping in to see her how she was before work, popping in after work to see how she's doing. I have not seen her for over a year, and I have only been able to see her outside once a week for 15 minutes, and it's not even at the home, it's from the sidewalk in front of the home, where she's given 15 minutes a week, 15 minutes, I repeat, a week of fresh air outside. So her greatest wish is, now that she's been fully vaccinated since January, is to be able to go outside and to live life again. The present situation, as she will tell you herself, is not living, it's simply existing. And so I'm asking you to please just provide hope to the thousands, 115,000 of vaccinated long-term care residents in Ontario who are suffering. That's my presentation. Thank you.
Mark, you concluded at 4 minutes and 59 seconds. That is well done. Let me open it up to members of the board. Any with questions of Mr. Maloney? I see Councillor Wong-Tam. Councillor Wong-Tam, are you ready?
Thank you very much, and thank you, Mark, for your deputation. I recognize how difficult this past year must have been for you, as well as for Virginia, and thank you for giving voice to the long-term residents who are in very comparable situations as she's in. My first question to you, Mark, is regarding the clarity of communication from the province and as well as from Toronto Board of Health. You are clearly a man who is able to do some research. You are very articulate. How easy has it been for you to navigate the system to understand what the protocols are when it comes to visitation and physical movement of long-term care residents?
Well, if you're asking about me personally, I guess the problem I'm in right now, and it's affecting other people, not just me, is that I'm not a family member. So I have no status really with the home. I'm just a friend, and I'm a neighbor and somebody who's looked after Virginia since 2008. It's been a difficult thing to navigate. Like they send out bulletins to family members, but they do not include friends on those bulletins.
Thank you. And because you're not a family member or a designated caregiver, it sounds to me like you are, Virginia and yourself are chosen family members to one another. Is that an accurate description?
Yeah, I have no family in Toronto, and when I came down here to Toronto to work for Mayor Barbara Hall and for Mayor Mel Assman, I had no family here, and Virginia has become my family.
Yeah, thank you, Mark. And with respect to chosen family, because I think we can all recognize that not everybody who's going to be concerned or loving someone who's in a long-term care facility is not going to be a family member, like meaning blood relations, or a designated caregiver. So there are probably thousands of people in the city who are in similar situations as yourself, chosen family to the long-term care patient and long-term care resident who have not necessarily seen each other in the past year. Is that the message that you're trying to convey to us today?
Yeah, I mean, I think it's absolutely gone from a situation where, as I said, because I live right near the home, I could go before work and I could go after work, which I was happy to do because it gave me like purpose. It's gone from a situation where seeing her, twice a day in the previous year to 15 minutes once a week outside from the sidewalk, and so I've seen a mental health issue with Virginia. She will acknowledge it. Her meltdowns are much more severe than they were. She just a host of. I'll give you one example. Bruce Kidd, the former athlete, Olympic athlete who worked with me at university, knows Virginia, has known her for 50 years. They had mutual family and friends together. Spoke with Virginia last week, and he called me afterwards and said that his most serious concern was the fact that she's been in her room for a year with little or no exercise at all. So we're talking 365 days of no exercise and virtually no real movement. So these are serious issues, and I can't get in to see her, nor can any friend of hers, and no other person can go in to see her and to try and deal with her mental health, to deal with even walking her around, the center or to keep her company. So there's been a marked problem and issue. Associate Justice Morocco, who's doing the provincial review, which will be unveiled, I believe, to the province on April the 30th, had deputations from residents themselves, and the residents themselves from long-term care homes said that the situation of where they've been in for the last year has become inhumane, and I truly do believe that. I'm not blaming the home. I'm not blaming the care staff. I'm just saying we have to come up with some procedures whereby if she's vaccinated and I'm vaccinated and tested, and I've been tested, several times, why can we not have some kind of, ability to see one another, and for me to be able to take her out to Parliament Street in her wheelchair, like as she did before, or to go to the neighborhood diner, So I'm just asking that somebody has to speak to the province. Somebody has to raise the issue. We have to get the province looking at this. I have no idea who or how at the province is dealing with this issue and how seriously they're dealing with this issue. I understand quite,
forgive me, Mr. Maloney.
Yep. No, I understand.
Councillor, Mr. Maloney, we're just coming up on over 6 minutes here.
Yep. Okay.
Thank you. Councillor, so we're just run through your time there, if that's all right. I'm just going to open it up if there are other members of the board with questions for Mr. Maloney. And I can't see everybody on my screen, so I'm just flipping between. Okay, seeing no further questions. Mr. Maloney, thank you very much for both the deputation and the suggested course of action. Our final deputant registered here today is Derek Moran. Do we have Derek on the line?
Hi, can you guys hear me?
Hi, Derek.
Hello.
Welcome. You'll have 5 minutes, and you can begin when you're ready. Thank you.
I'm just going to start my timer here. I just want to say, by me speaking at this meeting, this shall not be deemed to be in any way my consent expressed or implied. In doing so is fraud. God bless Her Majesty the Queen, and long live Her Majesty the Queen. And I know Scott Duncan would say if these variants of concern actually exist, there would need to be proof and or evidence that they have been sequenced. So in this report, it says mainstream ethnic and social media presence have enabled a focus on addressing vaccine myths and misinformation. Misinformation, especially on social media, contributes to hesitancy. So I provided excerpts from 3 links in my written presentation on reasons from a group called America's Frontline Doctors, the face of which seems to be Dr. Simone Gold, have said on why they are hesitant and are recommending against taking these vaccines. The first is titled, YouTube Bans Frontline Doctor Speech. It's really irrational to take a brand new, untested, untried technology from a company that's completely shielded from immunity, said Dr. Simone Gold. Recipient may become more vulnerable to virus. Brand new mRNA technology. First, what the doctors call the largest experimental medication program in our history uses a brand new technology utilizing messenger RNA. No vaccine based on this technology has ever been approved for any disease or even entered final stage trials until now. So there's no peer-reviewed published human data to compare how mRNA stacks up against older technologies. The AFLD, America Frontline Doctors, white paper stated that one of the greatest safety concerns relates to how prior coronavirus and other respiratory vaccines have failed due to the scientific phenomenon known as pathogenic priming that makes the vaccine recipient more likely to suffer a sudden fatal outcome due to massive cytokine storm when exposed to the wild virus. AFLD clarified that we are saying that by definition it is unsafe to widely distribute an experimental vaccine because taking a vaccine is completely different than taking an ordinary medication. As explained by AFLD, ADE, which stands for antibody-dependent enhancement, is when anti-COVID antibodies created by a vaccine, instead of protecting the person, cause a more severe or lethal disease when the person is later exposed to SARS-CoV-2 in the wild. The vaccine amplifies the infection rather than preventing damage. AFLD provides an example of a vaccine produced to fight the dengue fever, which resulted in deaths of 600 children in the Philippines due to ADE, and the filing of criminal charges against the decision makers in 2019. Manufacturers have no liability. Of great concern, as well as the fact that the companies that produce these experimental biological agents are immune from all liability due to the 1986 National Childhood Vaccine Injury Act. Therefore, those who are injured, or even the families of those who suffered deaths due to these injections, will have no claim on the manufacturers themselves. No independently published animal studies. Further, previous coronavirus vaccines developed over decades have consistently failed in animal trials with the deaths of their subjects. Yet these experimental vaccines have no independently published animal studies. Vaccine safety requires proper animal trials and peer-reviewed data. The paper stated, neither of which has occurred with these experimental biological agents. No proof that the experimental vaccines stop transmission of the virus. The doctors highlighted that there is no data on whether or not these experimental agents are actually capable of stopping the transmission of the virus. They affirm that the scientists are very upfront about the fact that they don't know if the vaccine even stops the spread of the virus. They cited a Medscape article that quotes a former FDA official who said, "We don't know if people who can become infected and thus transmit even with vaccination. For this reason, people can expect to still be wearing masks, still be asked to follow non-pharmaceutical public health measures that we've all come to know so well." In dismay, Dr. Gold explained this point in her presentation, saying, "What is super shocking is that there is no proof that this biological agent actually stops the transmission among people. It's a joke."
Derek, just a heads up, you got about 15 seconds left.
This is like the punchline to a joke. Let's take a vaccine, and by the way, it doesn't actually stop transmission. I mean, I don't even know what to say to that. My timer's going off, so that's my time.
Thank you very much, Derek. Let me open it up. Are there any questions for Derek, for members of the board? Okay, seeing none. Derek, thank you very much. At this point, members, we're going to take this into committee, and so we will open it up for questions of staff. And we do have a number of folks here, both from Toronto Public Health and Senior Services and Long-Term Care and Social Development and Finance Administration and others. Just by way of a show of hands, I can make a questioners list here. Those with questions? Okay, I'm making a list. I have Councillor Ainsley. Anybody else with questions? I have Councillor Wong Tam. Flipping screens here just to see if I catch everybody. Oh, Director Mulligan. Not ignoring you there, Director. I'm just flipping between screens. Okay, we'll get started. We have Councillor Ainsley, followed by Councillor Wong Tam, followed by Director Mulligan. Councillor Ainsley, when you're ready.
Okay, thank you, Chair Cressy. I guess the first question I wanted to ask about the vaccine rate, and I guess it ties in with the provincial government as well. I saw something in the news last week that I guess the goal was to be fully vaccinated by the end of September, or have most people at least one dose, but it was 4 months behind compared to other G7 countries. I was just wondering how accurate that was, or...
So through the chair, perhaps I'll take that question first, and thank you for it, Councillor Ainsley. I think at this point in time, what I can offer to the board is that looking across the city, Dr. Patty, in her presentation, spoke to our capacity here at the city and through our mass immunization clinics, and looking at what we can do in concert with what our health sector partners are able to do. I can tell you that here in the City of Toronto, we figure at maximum capacity, given the current resources that we have, our current clinic configuration, we can do about 500,000 doses a week. Now that's full on. With the full effort of our mass immunization clinics at the City of Toronto Public Health, and as well with our health sector partners. That, of course, is entirely dependent on actually having the supply of vaccine to go with that. That, to my mind, is the major factor limiting our efforts. And again, the more vaccine we can get, the faster we can provide vaccines in arms and the sooner we'll achieve the goal. So there is a bit of a moving target there, and it is very much dependent on supply.
Councillor
Mr.
Ainsley?
Chair, are we...
We're still here. Councillor Ainsley, did you freeze on us there?
All right. Are you okay now?
We can hear your audio. I think your Wi-Fi.
Maybe I'll turn off my audio. Maybe I'll turn off the video.
Okay.
Is that better?
That's much better. Thanks. Councillor, I'm afraid we still don't have you. So what I might ask is, I paused your time at 2 minutes. I might have you reconnect, and we'll come back to you if that works. Councillor, is that okay?
Yeah. Can you hear me now?
Now we can. Please go ahead.
Okay. Sorry, I'm not sure. So, Dr. Gill, when it comes to bars and restaurants versus nightclubs, I get a lot of restaurant owners in my ward that say that they think that they're doing a better job, or think they can do a better job in protecting people from COVID in a restaurant setting than in a nightclub, and they feel that they've been, for lack of a better word, lumped together with bars, restaurants, and nightclubs. Could you comment on that?
So through the chair, Councillor, I believe there actually is a separate distinction for nightclubs, and in the previous iteration of regulations, that nightclubs were only permitted to operate insofar as they were operating more like restaurant type establishments. As we move forward over time, again, what the specifics of the regulations look like are under provincial jurisdiction. I would, however, say this, that looking over the course of the entire pandemic, we know that activities that are done indoors with large numbers of people, particularly for those activities where masks cannot be worn all the time or consistently, things like eating and drinking, it is clearly a more challenging environment, and certainly an environment that lends itself to greater risk of COVID-19 transmission. Hence, there is a great deal of caution placed around expanding capacity or loosening restrictions in those types of environments.
Okay, and some of the restaurant owners, the example that they use or keep bringing up is Vancouver, and that Vancouver's had their bars and restaurants, or at least in-restaurant dining, open since June of 2020, and they're asking what the difference is between guidelines in Vancouver that allow that, and we're not allowing that in Toronto.
So through the chair, Councillor, of course, the regulations that are in place here in Toronto are reflective of what is occurring throughout the province, as that entire set of activities and the setting of regulations is something that the province is overseeing. What I can say is that when we look at the evidence, the scientific evidence and the experiences throughout the world, we know that indoor dining, just by its very nature, people together indoors, engaged in an activity where masks can't be worn consistently. These sorts of settings are known to be higher risk, absolutely, for COVID transmission. This is well documented in the literature. And hence, as I understand it, the reason why the regulations in Ontario are such as they are.
Okay, and I just wanted to quickly say, Councillor Cressy, I did have my own mother vaccinated last week through the Vaccine TO website is what I used to register, and it was very seamless and easy to use. And I just want to make sure your staff are congratulated for the work that they did putting it together for our citizens here in Toronto. Thank you.
Well, and congratulations to your mother, Councillor. That is great. Councillor Wong Tam.
Yes, thank you, Chair, and thank you to the Toronto Public Health staff for all your hard work. My question to you, Dr. Davila, is with respect to mobile clinics and how they prioritize where they're going and what type of capacity they have to immunize. Has there been consideration, and please forgive me, and it's already been discussed, but I wanted to find out if there's been consideration on working with the different school boards to ensure that we can actually reach out to the student population. So you've got 500 children to 1,000 students in a particular place at some point in time. When it's time to ramp up the vaccination program, can we not do it school by school? Is that a reasonable approach?
Through the chair, Councillor, thanks for your question. At this point in time, the vaccines primarily are licensed for recipients age 18 and older. Only the Pfizer vaccine is licensed for use in those 16 and above. So I will admit that, there are a number of efforts underway, including significant efforts at what we have here in Toronto as the health sector vaccine leadership table, where we're all working with our healthcare partners around how best to distribute resources for vaccination around the city. They are largely focused on those populations that are currently eligible to receive vaccine. Certainly there are studies ongoing right now looking at providing vaccine to younger populations as those studies come to fruition and we have more information, and as our federal partners, the regulatory agencies look at those new data, we'll have a better sense as to what we might do for younger populations on a go forward.
Okay, thank you. And with respect to essential workers and how it's being defined, I have received some inquiries, and it's obvious. Sometimes it's difficult to respond to constituents when I don't have the information. But perhaps you can speak to how essential workers are being defined and how they're being prioritized for vaccines. So, for example, grocery workers, those who are working in factories, we've called them essential workers, but they're not prioritized. Can you speak to that, please?
Of course. So through the chair, Councillor, the prioritization framework with respect to vaccine administration is actually a provincial framework, and that's what all of us at local public health are following. It was just recently, and to be honest with you, I can't remember the exact date. They do start to blur into each other, but they did, our provincial counterparts provided an update with respect to their phasing of the prioritization framework, and included in phase 2, which is supposed to start in and around the beginning of April, there is a category of workers called people who cannot work from home. And it's my understanding that is the category, if you will, where essential workers, what we've termed essential workers and what many of us call essential workers would likely fall under.
Okay, that's very helpful. And then I have a question regarding capacity, because this has been brought forward. And sorry, my questions are largely coming from constituents and other stakeholders. A question regarding capacity in faith facilities, so faith places of worship. With respect to the actual numbers that are permitted indoors, it seems to be, maybe you can speak to and explain to us and those who will be listening with respect to the rationale to how the current protocols were established.
So through the chair, I'll do my best, Councillor. As you know, the restrictions and the current limitations and all those regulations that have to do with places of worship are actually under provincial purview. So it's their guidance that's informing what the current state of affairs is. So as I understand it, and I'll let my staff correct me if I'm wrong, my current understanding is that The most recent iteration of guidance from the province allows for up to 15% within indoor settings for places of worship and up to 50 outdoors. That's the current provincial guidance. I would imagine they have a number of tables that are providing the decision-making folks there with all kinds of input. I would imagine that the process that was followed was, taking it to those tables and discussing with their scientific advisors at the provincial level.
Mm-hmm. Thank you. I recognize I'm out of time.
Thank you, Councillor. And just before we go to Director Mulligan, I had meant to mention at the beginning of questions that I would like to join the item we're dealing with here, the COVID response item, with new business item 26.7, which is reaffirming support for our medical officer of health, the Toronto Public Health Team, and a public health informed approach, so that we would be dealing with both items at once. And I would just note, practically for Councillor Ainsley and Wong Tam, if you have additional questions, because we've just done that after you've started, happy to go back to you. So now Director Mulligan, over when you're ready.
Thank you, Chair. And hello, Dr. Davila, and hello, team. I have a few questions. Some of them are about how things are going based on work that you've been leading over the last year and the last 6 months in particular. So one is paid sick days. We endorsed together a call for provincially mandated paid sick days in the fall. And I wanted to know how that's going, whether there's a sense that this could happen at the provincial level, and also how that has played out with respect to getting time off for vaccination.
So through the chair, thank you for the question. Certainly what I'm pleased to see is that there are many people that have rallied behind that very same call for paid sick days. Unfortunately, I'm not sure that we're, quite yet seeing what we would like to see, but that doesn't stop us from continuing to champion what needs to be done and what makes the most sense from a science-based perspective in our COVID-19 response.
Thank you. My next question is about an update about our work in the summer that this board declared that Black health and anti-Black racism constituted a public health crisis. And I'm wondering, I think I had expected an update to the board at the last meeting and then again at this meeting. So just wondering what the status is of actions taken based on that declaration of the summer.
So through the chair, I would say that most of our work has actually focused on that which has been related to the COVID-19 response. And perhaps if I might refer to Anania to speak specifically to that, as she's been one of our, extenders, if you will, and much valued colleagues in the response.
I'm going to ask, I've been cutting in and out. Okay, may I ask you to repeat the question?
Yes, Anania, thanks. I'm just hoping to hear an update on how we're doing with our work related to the declaration of anti-Black racism as a public health crisis during the summer of 2020.
Oh, you were really breaking up. Dr. Davila, are you able to hear?
Yes.
Yeah, Anania, I paused the time, and Anania, the volume is coming through on our end. I think it's just on your end.
Oh. Okay, let's try. How is this?
We can hear you fine. Can you hear me, Anania?
I can hear you now. It's breaking up a little bit. I apologize.
That's okay.
Understand the question.
Kate, I paused your time at 2 minutes, just so you know. So, Kate, third try.
Okay, thanks, everyone. I'm just hoping for an update on the work that has been undertaken since we declared anti-Black racism and Black health a public health crisis in the summer of 2020.
Okay, yes. So what is happening right now? So lots have been happening, but what I can tell you is that we're working on a Black health plan because we talked about doing the emergency response, which is what we're doing and in our update that we shared with you, but also to work on a Black health plan. Underpinned by the Confronting Anti-Black Racism plan. So that is in effect right now, and we're hoping to come to Board of Health with that in the spring. we're in the spring almost.
Okay, thank you. I'll look forward to hearing more about that. On a related note, anti-Asian racism has been in the news, particularly this past week. And I know this is something that Councillor Wong Tam has taken huge leadership on this year and prior to this year as well. And I'm just wondering if have we noticed an uptick in anti-Asian racism related to the pandemic or occurring here in Toronto? And what public health advice or measures, Dr. Davila, do you recommend?
So through the chair, yes, that is something that we have been working on, and it's certainly something that has been noted throughout the course of the pandemic at varying times. You may recall that early in the pandemic, this was particularly prominent, but you're quite right. It hasn't gone away, although there have been periods of time where it has been more prominent. Certainly what we're doing with that is that Anania spoke specifically about a Black health plan, but we also have an equity action plan writ large around our COVID-19 response, and this would figure as part of that. And again, it's all about just the general public health approach to any situation, including the COVID-19 response, that takes into consideration issues around equities and inequities and how best we address those. But certainly, I would say that it is probably at a point in time now where we need to invest further efforts on this particular aspect of our response, in light of recent activity. It's unfortunate we have to go back and reinvigorate our response because of recent events, but we're certainly happy to do that.
Okay, thank you. I see that I'm at 5 minutes, Chair. So could you put me on the list for the next round? Thank you.
Absolutely, and you actually have another 30 seconds still, but I will put you on the list for a second round. Other members of the board with questions?
This is Trustee Lopretti. I'm having trouble putting my hand up. Would I be able to ask a question?
Absolutely.
Thank you.
Trustee Lopretti, when you're ready, you can begin, and so you can start when you're ready, all 5 minutes.
Thank you. For the presentation, I really appreciate that we are only as strong as the strongest measures for the most vulnerable. The vaccine rollout is prioritizing communities most affected by COVID-19. Over the last few days, there have been media reports, specifically CBC, that not enough is being done in the Northwest, which has been disproportionately affected by COVID-19 since last March. Reports indicated that the Northwest had least amount of pharmacy locations available for the vaccination rollout. As we know, there is a high BIPOC population, high senior population. It is a low-income area. There is much vaccine hesitancy, high transmission rate, and multifamily households. I'm wondering what measures are being put in place for the Northwest part of the city, and are doctors' offices being considered for the rollout, as many doctors in the community have relationships with patients, there's trust, and they're more easily accessible?
So through the chair, thank you for that question, Trustee Lopretti. A couple of things. So you're quite right. I think that it was noted, and it certainly did not go unnoticed by us at Toronto Public Health, that pharmacy locations were not as prominent within the northwest of the city. That particular undertaking, having pharmacies as part of a distribution channel for vaccine was something. It's a direct partnership between the province and pharmacies themselves. So we heard about which locations were to be included in the first round of pharmacies. When we saw that list, we went through where other pharmacies are that are prepared to do this kind of activity, who are, for example, because they participate in the flu campaign, the flu vaccine campaign. And we found those areas in the city that we knew, premised on our data, are higher risk for COVID-19 and more impacted by COVID-19. So we have provided that list to the province to let them know that, look, as you expand your pharmacy channel, you should absolutely, in the city of Toronto, make sure that you're expanding preferentially in these neighborhoods because they're underrepresented There are pharmacies that are ready to deliver vaccine premised on their history with flu vaccine campaigns. And they're, these are places where we can actually have real value and real impact, knowing what we know about those locations. With respect to primary care, that is another undertaking that the province has underway. There are a select number of primary care practices participating in vaccine distribution as well. Because we were able to engage with the province as they started to talk through which primary care practices would be included into that in that effort, we were able to help direct those practices to be in those areas that are most impacted. They are not exclusively there, but the majority of them are at this point in time in those neighborhoods that have been most significantly impacted by COVID-19. That's the kind of efforts that we are putting forth, and we will continue to do so in order to address those very questions that you raise.
Thank you very much. I really appreciate it. And my last question is, following Kristen Wong-Tam's question about the vaccination rollout in schools, I understand that we can't vaccinate the students, but we can vaccinate their families, their caregivers, and we have access to so many locations, and they're easily accessible by caregivers, parents, the general population. Are you looking at schools in the distant future? Or on the weekends? I'm not saying not during the school day, but specifically on weekends?
So through the chair, right now, as you heard from Dr. Patty's presentation, we have 9 specific mass immunization clinic locations as part of that which is being operated by the City and Toronto Public Health. 3 are currently operational. The rest are onboarding over the course of the next few weeks. At this point in time, we have some capacity to think about pop-up or mobile type of undertakings, as would our health sector partners. They also have some degree of capacity for this, but we will not be able to be in multiple places at the same time. You start to lose some efficiencies in terms of having too many locations operating at the same time. That's not to say we're not looking at that. It's just that it has to be staged properly, and of course, one of the major factors that's in our impeding our capacity to expand continues to be vaccine supply. So we are en route to have our current existing roster of clinics established and getting them up and running. And then we'll look at opportunities to use, whether they're school type facilities or a number of other facilities that the city has available to it in terms of pop-up or mobile clinic efforts, depending on where we're seeing needs are emerging, or certain subpopulations or geographies might need a little extra push or a little bit of extra effort.
Thank you, Trustee LaPredi. Let me just caucus the board. Are there any other members of the board who haven't had a chance for questions who wish to ask any? And I'm scrolling. If you want to unmute yourself and indicate if I can't see you on the screen I'm on. Okay, seeing none. There was a request for a second round. So I have Director Mulligan. Let me just ask as well, making a list, is there anybody else who wishes to have a second round? Nope. Okay, Director Mulligan, over to you.
Thank you, Chair. I was very moved by the story of Virginia in long-term care and her isolation. And we know that social isolation and loneliness have significant health impacts for people, not just in long-term care, but throughout our society during this time of, vigilance in our public health measures. So I'm just wondering what measures are being considered to really address this and to address the growing mental health, but also physical health impacts that are being reported, for example, through the mental health organizations and community-based mental health organizations. Are there measures being considered or put into place to help reduce this significant public health issue?
So through the chair, very briefly, Director Mulligan, I share your concerns. And in fact, your concerns are shared by many of us in local public health. this very issue, the issue that was raised so eloquently and poignantly by Mark at this morning's meeting, have been issues that we have raised to our provincial counterparts. The current directives and practices that are being followed within long-term care homes and retirement homes are, again, these homes are considered healthcare institutions and are under provincial purview. We have raised this issue on a number of occasions with our provincial counterparts. We're continuing to do so. And, I hope to be back here in front of you, or perhaps, in the period in between, telling you that we've had good success in terms of addressing the situations and addressing those concerns that were so rightfully raised by the deputant this morning.
Okay, thank you. Some of the community-based organizations that have offered mobile testing have done social screening at the point of testing, referring people to supports related to their employment, their housing, their food, and their social isolation. And I know this is something that this board has called for in the past, social prescribing or social screening at the point of testing. So I'm wondering if you could provide an update as to whether that's happened, and if not, why not? Are there some significant barriers that we need to be addressing? And whether it could be or should be considered at the point of vaccination.
So through the chair, it's my understanding that we are, we're getting the clinics up and running and focusing a lot on the operational aspects of those clinics running, but there are efforts underway to include some further opportunities to interact in exactly the way you speak of with our clients. I do think that there are some good opportunities when we interact with individuals, whether it's in the context of testing or vaccination, to understand a little bit about their circumstances and to make those appropriate referrals as we have that therapeutic relationship established, whether it's in the context of testing or in vaccine administration. So, I echo your interest in seeing what we can do to maximize the opportunity that's in front of us. I think that's an important one, whether it's within the context of a public health or city-run clinic, or whether it's, an intervention that happens within the context of a healthcare setting.
Okay, thank you, Dr. Davila. And this is my last question. This has been such a hard year, and many important equity interventions have been made, but sometimes at great cost. And so what I'm wondering is, given that, we had that slide earlier about what the roles of each level of government have been with respect to vaccination, but we know they also play roles with respect to other pandemic requirements. And do you have a sense in the work that you're doing now in public health of what the state of public trust is in Toronto Public Health and in the other levels of government as we're engaging in this work? And what do we need to be doing now to ensure that we do have strong public trust and public confidence?
So through the chair, Director Mulligan, I know that we have certainly seen and have heard about polling that has happened, right? That's often reported through the media. That offers us one point of view. We have done polling ourselves, or done surveys, I should say, more appropriately in the past. I admit we have not done one as of late. But certainly we are concerned about ensuring that there is a strong sense of confidence and trust in that which we are providing as the local public health unit. I do believe that that's a work in progress. My sincere hope is that the work that we're doing in concert and supported, in great part by our colleagues at Social Development, Finance and Administration around a health equity action plan, and all the work that we're doing in partnership with them and with others on community engagement, I hope is going some ways towards ensuring that we maintain and build on that trust and confidence. But I suspect that this will be a work in progress for many, many years yet to come. I think that the real opportunity for us is not only in the here and now, in this component of the COVID-19 response, probably in one of the most challenging phases of the response, I would say. But I think that the emergence from COVID-19 may even be a more critical component for us to get right. So certainly I look forward to the conversations, the important conversations I know we will have at this board in order to ensure that we're doing that in a way that bolsters our communities and frankly our relationship with our communities on an ongoing basis.
I appreciate your response, Dr. Davila, and I thank you for your work on this.
Thank you.
Thank you, Director Mulligan. Let me just do a final call for any other questions from members of the board. Oh, Director Sue Wong. Yes, when you're ready.
Thank you very much, Mr. Chair. I have two questions to the Medical Officer of Health, through you to her. So the first question is, just to follow up with Councillor Wong Tam's question about the mobile unit with the City of Toronto. So I want to know, has the city staff actively reaching out to the life lease building for seniors? Okay, these are not nursing home, these are not retirement home, they're standalone seniors building. They're over 65, many of them well into their 90s, to ensure these seniors are getting their vaccine.
So through the chair, there is an effort underway not only by the City of Toronto and Toronto Public Health, but as I've mentioned in some of the answers to some of my questions, there is a health sector vaccine leadership table. We have hospitals, Ontario health teams, and actually they've been equipped with information which we've received very generously courtesy of our colleagues at University Health Network. We actually know where the what's known as naturally occurring retirement communities, multi-unit dwellings, buildings where there's a significant proportion of seniors. We're actually going through those lists with our health sector partners to try to figure out which buildings have the greatest proportion of seniors so that we can focus our resources in the most efficient and effective way for precisely what I think you're getting at, trying to make sure that we are able to provide those services as best as possible to those who most need them.
Okay, and then the next question to you, Dr. Davila, is regarding the provincial portal for asking the question when you pre-register. Similarly for the City of Toronto, there should be a question that allows family members, like for example, my own family, but other extended family member, have 2 or more family members who are over 80. So instead of multiple application, there should be a question, say, are there any other family members who are over 65, or in my case, over 80s, so that way they don't have to go through 3 applications. So there should be somewhere on the portal to ask those questions. So I just gave you my example. I had to reapply 3 times for 3 different family members. They're all over 80s. One got the vaccine, the other 2 haven't. So it's been very frustrating. There should be somewhere in the portal ask the straight question, are there any other family household with the age requirement, that meets the age requirement?
So through the chair, I'm certainly happy to raise that with our provincial counterparts. Again, the booking systems that we are using is provincial software. So we have limited ability to change it per se, or at least directly, but I can certainly raise and provide that feedback to our provincial colleagues.
Thank you. That's it, Mr. Chair.
You're welcome.
Thank you, Director. I'll do one final call. Members of the board with questions? Councillor Wong Tam, second round.
Yes, thank you. I wanted to just get this out there. With respect to restaurants and indoor capacity at some point, I think on the city's website still says that obviously once we go into the right color zone, we could see permitted indoor dining perhaps go up to 50%. I'm still a little bit confused about how those numbers are arrived at, and I recognize it's sitting under a provincial banner. So this may be putting you in an unfair position, but how do we reconcile the 50% indoor dining versus the 15% indoor capacity for places of worship? And if you could just, maybe for the public record more than for my own purposes, I think there just needs to be a clear explanation of that.
So through the chair, Councillor, as you alluded to in the question, I'm not privy to how the decisions are made. I understand that there are tables. There's a public health measures table. There is a COVID-19 science advisory table. And these are 2 that are understood or at least known to exist in respect of where advice might be coming to the decision makers at the province. But I don't have, you know, a line of sight into how those decisions are specifically made to be able to explain what you note between places of worship and indoor dining.
And so is it a matter of seeking clarification from the province? Because and the reason I ask is because I think people just want to know how are these decisions made. And it's very difficult, even as a member of Board of Health, to explain when we are reliant on information that comes through this channel, if it's relied on somewhere else that's just not being as transparent. What's the best way for us to explain to residents and business owners and anybody else who's interested, in a sentence or two, how should we respond? Is it a matter of asking them to go talk to the province, which sounds a little bit like passing the buck, which I don't want to do. But if you think that's the most appropriate way for us to reply, then I think we have to do it. Your assistance would be appreciated.
Of course. So through the chair, Councillor, thank you for that. I would say that when we have been asked specifically here at Toronto Public Health around the specifics of the regulations and rationale behind the regulations, we have generally suggested that, look, these regulations are in fact provincial regulations, and they are the party that is best positioned to speak to how those the specifics of those regulations were landed on. You know, what we talk about here is our understanding of the science, and certainly anything that's under our direct purview, we're happy to speak to, but it is challenging to speak to the regulations that are written by another level of government.
Thank you. So Dr. Davila, just to sum it up, because I think that there may be folks who are paying attention to this piece. With respect to bathhouses and their safe reopening, with respect to long-term care residents and their ability to physically move around, with respect to indoor occupancy of restaurants, all of that and more is sitting with the province. Is that correct?
Through the chair, that is correct.
Okay, thank you.
Thank you, Councillor. Final call. Any other members of the board? Okay, seeing none. Dr. Davila, I just have a few. The first is I just wanted to clarify in response to a question that Councillor Ainsley met at the beginning regarding vaccine capacity in Toronto. Did I hear you correctly that Toronto, the city mass immunization clinics and our hospital partners combined have a capacity to deliver 500,000 doses a week if supply is available? Did I hear that correctly?
Through you, Mr. Chair, that is correct under the current configuration of clinic offerings right now.
Okay, and that's the city's mass immunization clinics and our hospital and healthcare partners combined?
Through you, Mr. Chair, that is correct.
Okay, thank you. And then I've heard you speak in recent weeks about vaccine distribution. And so my question here would be, during this period where vaccine supply is still limited and we see high COVID transmission, especially a disproportionate level of COVID transmission in some areas, is it your recommendation that the province should adjust the distribution to reflect high transmission areas and the increased number of priority groups in areas like Toronto?
So through you, Mr. Chair, yes. And in fact, we have made requests of the province and indicated that we feel that it's important, premised on science, that vaccine doses get directed to areas of high transmission and higher risk of COVID-19.
Okay, thank you. And then just final question here. I heard Trustee LaPretti, her questions for you were related to the pharmacies pilot and a question around access to pharmacies for vaccines in some hard-hit neighborhoods of the city. So I just wanted to make sure I understood the locations of those pharmacies. They were selected by the province and the pharmacies directly?
Through you, Mr. Chair, yes.
And did I hear you correctly that upon seeing the location of the pharmacies, the Toronto Public Health noted areas that would require increased access and suggested to the province locations that have participated in the past through the flu campaign? Is that right?
Through you, Mr. Chair, that's correct. The pharmacies that we saw were in areas of higher need, and also that these were pharmacies who would be prepared to do vaccine campaigns given their previous history in flu vaccine.
And just in terms of what we might expect, I understood that the province last week announced that there would be additional pharmacies coming online in Toronto as part of the pilot. So is it your hope, based on the list we've provided, that we would see greater representation now, based on that feedback, in areas of highest risk or higher risk, I should say?
Yes, through you, Mr. Chair, our hope is that as they expand the pharmacy locations for vaccine distribution, that it would include some of these that we've provided them on a list that are in higher risk areas and would benefit from having such a pharmacy program. Okay, those are all my questions. Thank you. So we'll now turn to speakers. Let me draw a speakers list here, and I'm going to put myself on to speak as well, because I have a motion to move, which I know many of you have been engaged with, but can I just see, in creating a speakers list, those, if you want to indicate if you want to speak on this item? Okay, I see Councillor Wong-Tam, myself, I'm just scrolling through the other screen, forgive me, and perhaps if folks could help me out and unmute themselves, just indicate if they want to be put on the speakers list, that would be helpful also. Okay, so I have myself and Councillor Wong-Tam to start. Let me begin, and so I will begin first of all by moving an amendment on the first item, HL 26.1, response to COVID. And then I will also be moving the recommendations in my letter on item HL 26.7, reaffirming our support for the medical officer of health. Let me begin, first of all, by walking through the amendments here in front of us. The first, there are three components to the amendments on data and vaccines. The first is, since the medical officer of health moved recommendations for the province to collect disaggregated data, the good news is that the province has committed that they now are. They are collecting vaccine disaggregated data based on race, income, household size, language. And so the first amendment there is to request them to continue doing that now that we know they are. The second amendment related to data and vaccines is to request the province to enable a sample size questionnaire that Toronto Public Health has suggested as part of the vaccine data collection, so that we can do a deeper dive on a sample size basis to look at issues related to sexual orientation, disability, other medical risk factors, employment status. And the third amendment related to data and vaccines is to request that this disaggregated data be shared publicly, be shared with us, of course, at Toronto Public Health, but also with the broader public. The second amendment relates to vaccine distribution. As our medical officer of health has noted in recent weeks, this is following her request to the province to adjust the allocation of vaccines so that areas with a higher number or a higher proportion of people within phase 1 and phase 2 are accounted for, regions with higher transmission are accounted for, and also local capacity to deliver vaccines rapidly. You heard Dr. Davila mention that we have the capacity in our city, between us and our healthcare partners, to deliver upwards of 500,000 doses a week. And so we want to get as close to that as possible. And then the other component of vaccine distribution is a request to ensure that vaccine access supports the disproportionately affected and hard-hit neighborhoods, including in the selection of pharmacy and clinic locations. And that's a request to the province. Final two components of amendments related to a question that is emerging regarding what is the legislation and the rules and the best practices around vaccines and mandates. And so this is to do a deep dive in our due diligence to report back on the authority and advisability, both of the city and the province, to consider vaccine mandates, and to consider that from a range of factors, because there's a lot here. From a legal perspective, from precedents, but also implications for marginalized communities and communities dealing with vaccine hesitancy. We need to do due diligence and a deep dive on this, and that's a request to do that. Carrying on with the amendments, as part of the Indigenous-led vaccine campaigns underway for Toronto Public Health and our immunization task force to support the efforts of groups like Anishinaabe Health,
Adashomino, Native Child and Family Services, and to make any and all resources available. And as Councillor Wong Tam I know will speak to, there is an amendment here requesting a report back on the current provincial strategy to establish protocols to enable physical movement within long-term care homes for residents in a safe manner. So those are the amendments to HL 26.1 that I'm moving. And we're also dealing with the new business item, HL 26.7, which I will speak to just very briefly here, because after 14 months of this pandemic, everyone in our city is struggling, some far more than others, as we know, and we acknowledge that. But I would also note that many in public health and our public health staff are also struggling. Too often, especially in recent weeks, we've seen the debate move from legitimate debates over public health measures and restrictions and supports to threats and slander, from protests at people's homes to abuse of our frontline contact tracers, from inflammatory headlines about dictatorships to direct threats. It's unacceptable, and as a board, I think it is critical that we clearly and unequivocally affirm our support for our medical officer of health, for our entire Toronto Public Health team, and that we affirm our willingness to continue supporting a data-led public health approach. And so with that, I've already spoken for nearly my full time. I will just close by saying that we are, despite a year in, and with the great hope and optimism of vaccines and the largest immunization campaign in our country's history underway, we're also at the beginning of a third wave. And so now is the time to roll out these vaccines as quickly as possible to the most vulnerable, to maintain restrictions in a manner that reduces contact, but also enables people to cope with mental health and the need for safe outdoor activity, and at all times to support those most disproportionately affected who have been continuously far too hard hit through this pandemic. And with that, I will conclude my remarks and thank all members of the board for their hard work. And now I will turn to those amendments removed, and I should note along with the staff recommendations. Next up I have is Councillor Wong Tam. Councillor, when you're ready.
Thank you very much, Chair, and thank you for placing the motion on our behalf. It was really great to see this work to come together. I just want to begin my remarks, as we always do, to thank Dr. Davila and the incredible team at Toronto Public Health. And I also want to add in at this meeting to condemn in the strongest possible ways any personal attacks, any physical threats, any type of condemnation that may have come and directed at our staff. I would say that you have to get through us before you get to our medical officer of health and her incredible team, who have put herself and her family through incredible volumes of work to keep all Torontonians safe. And I just want to be able to convey that publicly, and I'll say that in meetings, and I'll say that to anybody who raises the issue with me. There is no room for any of that language, especially since we are now upon spring. And with spring, I believe, comes with a sense of hope and renewal. And that's what I'm seeing in the city. And I want us to embrace what has been a really difficult year. But coming out of that is a city stronger and more resilient than ever before. And the message of hope will be conveyed, and it should be conveyed in all our messaging with the City of Toronto, because not only do we have 4 federally approved safe vaccines, millions of more of these vaccine shots are coming to our shores. And obviously the city is engulfed in the work to roll out the immunization as quickly as possible. We just all have to hang on. And of course, a resolution is coming. It is not perfect, but given where we are and the resources that have been deployed, I am really hopeful about the future. Obviously, we still need to address vaccine hesitancy, and we still need to address the issue around access to vaccines and its equitable access to vaccine. And I think that's where Director Mulligan has just been extraordinary in making sure that the issue is raised constantly and I think very eloquently in every single meeting. I want to offer a comment about communication And I know that this has been difficult because strategic communication has been rolling out press release after press release. Obviously, Toronto Public Health, their comm staff have been doing the same. It is an incredible amount of work to try to cut through the clutter to make sure that we are heard, and to be heard in the 30 or 40 different languages that communications is going out in. And this is obviously the most diverse city in the world. We have the most diverse population in the world, all calling and choosing Toronto home. And we have to make sure that we are able to meet people where they are in the appropriate languages that they speak in. So yes, it takes time. And I know that every single issue and every single item that needs to be addressed has been brought forward to Toronto Public Health has been addressed, and they have not. It's never going to be addressed perfectly, but I know it's on the work plan to make sure that the information gets out there and gets out there through the help of community clinic partners, as well as ambassadors, peer ambassadors that are going out to build relationships and strengthen relationships and provide timely and accurate information to the communities that they have influence over. And I want to thank all those individuals who are working on the campaign to roll out the vaccine, because it's not as simple as, of course, rolling up your sleeve. You got to get people there, or you got to go to where people are. With respect to communication coming from the province, I know that our board has expressed on numerous occasions sometimes the frustration about working with another order of government that may not be working at the same pace that you are, or perhaps they just have slightly different priorities. But what we have seen, just by way of example at today's meeting, is some confusion with the long-term care sector, residents and their mobility indoor and as well as outdoors. I don't think any of us can actually stay indoors for a full year without actually going outside. I think it's going to obviously deteriorate our mental health, but also our physical health. And with respect to the different sectors, and as they're trying to grapple with the rules that are coming from the province, and then they use us as an interpreter, if the rules coming from the province are not clear, then we're not going to be very good interpreters. So we need the province to get stronger and more proactive with the way they communicate their safe reopening, because it's tied together with the message of hope. We cannot give people the sense that things are going to get better and that we're going to get built back better if we can't communicate better. And that is something that I know, will continue to strive to do, but we're really going to need our provincial partners to step up on this and make sure that they don't let it go, but also to convey it in the ways that we need to hear it in Toronto, especially in the different languages. Thank you very much, Mr. Chair.
Thank you, Councillor. Are there any further members of the board who wish to speak on this item? I see Councillor Layton. Councillor, when you're ready.
Yes, thank you very much, Mr. Chair. I'm going to save my thanks to last, because first I'd like to just address an issue that came up earlier. You know, my daughter is of school age. She's in senior kindergarten, that first level of class that has started out in this, let's call it this current reality that we're living in. And I want to show you something. This was the first day of school. You can't really get it in the video, but those eyes are still smiling. Despite all the disruption, despite the masks, the additional hand washing, which, like, to be honest, we should have been doing anyhow, the forms that we need to fill out, despite the inability to get as close as she'd like to with her friends and share the straws and do all the things that we're bringing home the sniffly noses every couple of weeks, our kids are still happy, right? We're keeping them healthy. And I don't see this as being an attack on personal freedom. Much more, this is our commitment and a way of us demonstrating our commitment to each other, to our communities, showing our love for those around us who we hold dear and close, like the Nona that hasn't got to see this beautiful little grandchild in months and hug her since last summer, but also to those that we don't know, those that are working in our stores, those that are making our food, those that are carrying parcels around, right? This small act is our demonstration of that commitment to what we call a society. You know what, Dr. Davila, my daughter gets that. And despite how many may be attacking, and I did something terrible, I scrolled through a bunch of comments on something a couple nights ago and made me absolutely depressed, but my daughter gets that. And if you go to any schoolyard and you watch those kids run around, they're still playing. They're still being kids. We will get through this, and the only way we're going to get through this is if we take advice from science and not skeptics. We put trust in our ability to work together to resolve these problems. Now, I wish she didn't have to wear that mask. She doesn't like it. I don't like that she has to, but she understands why. It's to protect herself. It's to protect that Nona and that grandma that she loves. It's to protect her other friends at school. And it's to protect all of those that she comes in contact with. And she's going to look back at this and be proud, I'm sure, that she accomplished that. I do want to say that I have been enormously impressed with how fast the city's been able to mobilize our vaccination clinics. And I do wish, for Phoebe's sake, for my sake, and for that Nona, my mom's sake, that the other levels of government come through with that vaccine so we can start immunizing 500,000 people a week, as Dr. Davila outlined. Thank you very much. And thank you very much, Doctor, for your continued hard work. And Joe, I'll say it again, I can't wait to cuddle little Jude for what will be, I think, only the second time in about 2 years.
Thank you, Councillor Layton. Jude agrees. Other speakers? References to my youngest son are not required in order to speak. Only son. Seeing no other speakers, I'm just scrolling through. Okay. With that, to our clerks, we'll then move to take a vote. First of all, so we're dealing with the first is item HL 26.1. There was a package of amendments with thanks to many members of the board for contributing to that. If it's the will of the board, can we take the amendments and the staff recommendations as amended, one item? Okay. So all those in favor of the item as amended? Any opposed? Seeing none, that is unanimous. And then we also have, which we were dealing with, item HL 26.7. This is reaffirming our support for the medical officer of health and a public health approach. And this is, I would ask the recording secretary for a recorded vote on this one. This is for the board to reaffirm our support for Dr. Davila, the City of Toronto, and the entire team at Toronto Public Health, and recognize their tireless work, and to continue to support a public health data-informed approach. I'd ask for a recorded vote, please, to our recording secretary.
Directors, when I call your name, please unmute your mic, indicate your vote by stating in favor or opposed, and put your mic back on mute. Director Paul Ainsley.
In favor.
Director Ashna Bowery.
Favor.
Director Brad Bradford. Director Brad Bradford, I think your microphone might be muted. Director Brad Bradford, did you want to cast your vote?
In favor.
Thank you. Director Joe Cressy.
In favor.
Director Stephanie Donaldson.
In favor.
Director Angela Johnson.
In favor.
Director Mike Layton.
In favor.
Director Ida Lepretti.
In favor.
Director Kate Mulligan.
In favor.
Director Gord Perks,
In favor?
Director Peter Wong,
In favor.
Director Sue Wong,
In favor.
Director Kristen Wong-Tam,
Strongly in favor.
Mr. Chair, the vote is unanimous with 13 Board of Health members in favor.
Thank you. Never in doubt, but Eileen, we have your back. That concludes this item. We now turn to our final item on the agenda, which is item HL 26.8. This is a new business item that, in partnership with the Toronto Food Policy Council, I am bringing forward. So that item is on the agenda. Let me just begin to see if there are any questions of city staff. It's a new business item that I have brought forward, so there may be questions of me, but first, are there any questions of city staff? Okay, so on the item, I will speak to it. So we have heard this has been a year of incredible destabilization for all, and that includes our many partners working tirelessly in the Toronto Food Policy Council. At the beginning of this pandemic, because of the emergency response, a lot of the work of Toronto Public Health had to pivot to dealing with the pandemic, whereas a lot of the food security work and that tireless work has been supported through our partners in social development and finance administration. And that has created some challenges for TFPC in terms of their work and support. And I would just note concurrently from that, there's a real and strong discourse within the Toronto Food Policy Council around an anti-racist analysis to their work and a call for renewal. And so the recommendations here that I'm bringing forward in front of us that we've worked closely, and I want to thank and commend the Toronto Food Policy Council and their chair, Rachel Gray, is for 3 items. And we've worked closely with city staff on these. The first is to ensure that there is immediate staffing support immediately through the City of Toronto to support Toronto Food Policy Council. And I'm glad to say through working closely with the Medical Officer of Health and the team at Social Development and Finance Administration, they have confirmed that is available. The second is as part of the upcoming report that we have coming shortly from the Anti-Black Racism Unit and Social Development and Finance Administration on Black food sovereignty, something we called for options for resourcing and staffing support specifically tied to adequately supporting Black food sovereignty, infrastructure, leadership, and capacity, that we hope to see that in the report. And that report will be coming to us shortly. And the third here, and I think this is critical, is as we go forward, ensuring that there's support for the Toronto Food Policy Council and a greater level of understanding of Black food sovereignty is not enough. Rather, we want on a go-forward basis to strengthen the work of the Toronto Food Policy Council and the work of food policy, food security, and food systems in our city writ large. And so as part of that review on a go-forward basis is to report back, to do the due diligence in consultation with food partners in the council on an optimal model for the TFPC and its relationship to the city and city council decision-making. Is it still as a subcommittee of the board? Does it become a formal advisory committee of a standing committee of council? We need to do that work. How do we ensure sustainable resourcing options to support that? And how do we ensure that all of those efforts align with food security and equity and the broader COVID recovery? And so, board members, that is the background and rationale for this. I want to commend again all the work and the partners and the leadership from TFPC, and I would ask for your support so that we can provide them the urgent day-to-day support that they need, and also to elevate the central and critical importance as it relates to anti-Black racism and food work right now. So that is the motion in front of us. I will see if now I will turn it over to see if there are any other speakers on this item. Seeing none, the motion is in front of us. All those in favor? Any opposed? Seeing none, thank you. Members of the board, that concludes this meeting. We meet again in just over 3 weeks. It's a tight turnaround for our next meeting. And with that tight turnaround, I should note, just as we depart, I know that The Toronto Public Health team is working on a comprehensive presentation for that item, and we're anticipating reports from some of our other divisions, but we're not anticipating a dozen reports from Toronto Public Health, that's for sure. I know that, given that it's in 3 weeks, but members of the board, look forward to seeing you all again shortly, and to Dr. Davila and team, keep up the tireless work. Thank you.